Victoria, please do share with us your thoughts as well.
Thanks, TJ. So I'm CEO of Alina Vision. So Alina's mission is to develop a network of sustainable eye centres in underserved markets. And we provide high quality eye services to people across the income spectrum. So this includes things like cataract surgery, eye checks, glasses. We also check people and treat blindness or vision loss that's resulting from diabetes, which is obviously a growing issue. The second part of our mission is around training. So we also support the professional development of eye care personnel to make our staff eye care leaders in underserved markets as well. So our first hospital is in Vietnam, just outside of Hanoi, in a place called Hun Yên province. And I'm really hoping to get there at some point soon. I guess I would say Alina's unique features, there's three parts of our social enterprise. The first one is quality. So in Vietnam, the outcome when you go for cataract surgery is sometimes not great. And that fills people with a little bit of fear about whether they should seek treatment. So Alina's surgical outcomes are about 20 percentage points higher than the Vietnam market average. And we're also consistently above the WHO benchmark as well. So we've set up some solid clinical protocols, and we have a really rigorous clinical monitoring system, but also our training in-house enables us as well to deliver those outcomes and means that more people will seek services. I think the second part is around cross-subsidization. So we operate a tiered pricing model, which means that all patients get the same high quality care. It's just they choose a package that they can afford. So we undertake significant outreach programs into the community and work with government as well to reach and provide access to many, many people. And as of a few months ago, about more than half of our patients receive treatment free or at a low cost. And the third feature I'd say, as I mentioned before, is training. So in Vietnam, only about a third of ophthalmologists are actually able to do surgery. And cataracts are the cause 75% of blindness. So that's a lot of cataracts that aren't being operated on. So our model is really focused on building the different cadres of eye health personnel, including surgeons, who can not only do surgery, but do surgery at a really high quality, again, to give patients confidence of their outcomes. So I think that these three features altogether really mean that anyone can get high quality eye care in Vietnam, and we're hoping to expand out of Hanoi and into other parts of Vietnam, as well as into the broader Asia region shortly. So just a few sort of figures to finish for me. So far, we've been operating for a couple of years. We started just as COVID ramped up, but we have screened about 53,000 patients for eye checks, and we've done about 4,000 cataract and other surgeries. So 20% of those have been free. And we've also trained 2 surgeons, 3 other medical ophthalmologists, and also 21 nurses. So I think Alina delivers on health outcomes, but also obviously addressing blindness and vision impairment also helps with economic and socio-cultural outcomes and educational outcomes as well. Thanks, TJ.
Thank you, Victoria.
Sure. There's definitely lots of challenges over the last couple of years, like everybody. I guess I'll just pick one, which is that COVID in Vietnam, the government took an approach quite similar to Australia, actually, which is hard lockdown. And hard lockdown meant that we couldn't do much outreach into communities during that time when COVID was really bad. So we had to look at a different way to reach patients. As a new brand in the market, we we had to sort of get creative. So it did, TJ's right, it did present some opportunities for us. And I guess there was two positives that came out of that. One was that we had to accelerate our investment and work around getting our brand and profile out there in our local area, and do that work to get more walk-in patients in. So that was something we'd always planned to do, but it accelerated that, and that channel provides more profit for us, obviously. So that means we can probably get closer to sustainability quicker and then reinvest those profits for more free or low cost treatments for patients. So that was the first positive. I think the second sort of opportunity was because we couldn't take the team out into the community to do screening, we had to bring the community in to the hospital. So that meant transporting lots of people in to do screening at the hospital, which is a little bit expensive, but it did offer a great opportunity for many, many people to experience what our hospital looks like, and to feel confident that they would have quality services and then could go back to their community and be advocates for us. So this also enabled us to keep our volumes up over COVID, which also meant that our trainees could keep their training going, because they need a certain number of volumes of experience in order to get certified. So I think they were the two opportunities that came out of something that was initially quite stressing on our business model. And in terms of TJ's last point around sort of the changes we hope to make within this sphere, for us, our Vietnam hospital is the first hospital, and it's progressing well, but we hope to expand our footprint and really ramp up our impact with more people being screened and treated. We hope soon to be self-financing and can therefore then self-fund our growth as well. But I guess our very, very immediate priority is around really proving our business model and then seeking further funding, including attracting in new funding to eye health and new funding to impact, particularly from the private sector, to help support our objectives of ending avoidable blindness and vision impairment. Thanks.
Thank you very much, Victoria.
I think one of my big takeaways is around learning and capturing learning. I think I've sort of found a lot of people are really, really interested in the things that haven't gone so great and how we've pivoted or changed as a result. And so I'd suggest that there's lots of support out there, like Nicola has said. They're also interested in how we change and how quickly if something's not working. So that's probably my big takeaway.